Hi guys. In our last video, we learnt about the overview of anatomy of human pharynx. In this video, let's focus on the detailed anatomy of nasopharynx. The specific learning objectives of this session are: at the end of this video, you should be able to define what is nasopharynx, demonstrate the extent of nasopharynx, identify and demonstrate the boundaries of nasopharynx, demonstrate the important features that are present in each of the walls of the nasopharynx. So with these objectives, let's begin our discussion of nasopharynx. Let's try to identify the features of nasopharynx now. Nasopharynx is otherwise referred to as epipharynx because of its cephalic position. It extends from base of the skull to the level of the first cervical vertebra or the atlas. Okay, so this is the extent of the nasopharynx. As we can see, nasopharynx has the following boundaries. It has got a roof, a posterior wall, a floor, right? This is the floor, an anterior wall. Then it has got a lateral wall. Let's try to identify the features of each of these boundaries. The anterior wall, as we can see, is deficient. You cannot see any partition, right? So anterior wall is deficient. The entire nasopharynx communicates with the nasal cavity through the posterior nasal openings, otherwise known as choana or posterior nasal apertures. So remember, anterior wall is deficient and communicates with nasal cavity. Coming to the roof and the posterior wall, as we can see, the roof and the posterior wall forms a continuous sloping surface. It is formed by the body of the sphenoid. Then we have the basilar part of occipital bone and the anterior arch of atlas. So this is the continuous sloping surface formed by the roof and the posterior wall. The roof and posterior wall are peculiar because they present important features. The junction of the roof and the posterior wall presents submucosal aggregation of lymphoid tissue known as nasopharyngeal tonsil. Nasopharyngeal tonsils are well developed in children and usually atrophies in adults. When enlarged due to infection in children, it forms a characteristic condition known as adenoid. So this is the location of nasopharyngeal tonsil. Nasopharyngeal tonsils form the most dorsal part of Waldeyr's ring. The next important feature is sometimes projecting into the substance of the nasopharyngeal tonsil, you get a mucus diverticulum. Okay, that mucus diverticulum is known as the pouch of Luschka or pharyngeal diverticulum. What is the importance of this pharyngeal diverticulum? The pharyngeal diverticulum or pouch of Luschka develops because of attachment of the notochordal cells to the dorsal wall of the foregut during embryonic life. The pharyngeal pouch or pouch of Luschka has mucus glands, and sometimes the secretion of these glands can block the diverticulum. Occasionally, the pouch can show chondrification, that is, formation of cartilage, representing a tumor-like condition. Then, the third important feature that we need to identify in the nasopharyngeal roof and posterior wall is something referred to as pharyngeal hypophysis. Remember, in this junction of the roof and posterior wall, sometimes we get the glandular tissue which resembles the pituitary gland. Okay, now this is referred to as pharyngeal hypophysis, believed to be a derivative of the Rathke's pouch. Right? So this is regarding the features of the roof and the posterior wall. Then let's see about the floor. The floor of the nasopharynx communicates with the oropharynx through a narrow space referred to as the pharyngeal isthmus. Okay, Now this is referred to as the pharyngeal isthmus, this junction or this narrow space, which is bounded by the posterior surface of the soft palate. Okay, this is the posterior surface of the soft palate. Posteriorly, it is bounded by a muscle referred to as palatopharyngeus, which forms a ridge-like structure referred to as Passavant's ridge. Okay, then on either side, it is formed by a fold referred to as the palatopharyngeal fold. You can see this fold, right? This is the palatopharyngeal fold. This forms the lateral boundary of the pharyngeal isthmus. Why do we need to know this? The pharyngeal isthmus actually prevents the entry of food from the oral cavity back into nasopharynx during swallowing, and that occurs by approximation of anterior wall with the posterior wall so that nothing passes through. This is why we should know regarding this junction or pharyngeal isthmus, which helps in communication of floor of the nasopharynx with that of oropharynx, right? So this is regarding the floor. Let's see the features of the lateral wall. The most important feature of the lateral wall is this pharyngeal opening of auditory tube. Okay, the auditory tube or Eustachian tube is a membranocartilaginous tube which extends between the middle ear and the nasal cavity and helps in maintaining air pressure in the middle ear. The position of the pharyngeal opening of auditory tube is about 1 to 1.5 centimeters behind the posterior end of inferior nasal concha or inferior nasal turbinate. The next important feature is the elevation that we see above the tubal opening. This is referred to as the tubal elevation. Beneath the tubal elevation lies again submucosal aggregation of lymphoid tissue, which is referred to as the tubal tonsil. Along with the nasopharyngeal tonsils, the tubal tonsil forms an important component of Waldear's ring. Tubal elevation acts as a guide in introduction of catheter into the pharyngeal opening of auditory tube. Why do you need to introduce air into the auditory tube? This is done in case of retracted tympanic membrane. Coming from the tubal elevation, we have two important folds. This is the salpingo-palatine fold which comes to the palate, and then we have posteriorly the salpingo-pharyngeal fold which goes into the posterior wall of pharynx. These two mucous folds arise from the tubal elevation. The salpingo-pharyngeal fold beneath the mucous membrane has the muscle of the same name. The next important feature that we need to identify in the lateral wall is fossa of Rosenmuller. Behind the tubal elevation, there occurs a deep mucous recess. This is referred to as the fossa of Rosenmuller. Why do we need to know about fossa of Rosenmuller? Fossa of Rosenmuller is one of the site of nasopharyngeal carcinoma. Because of the hidden position, the carcinoma which occur in fossa of Rosenmuller are often difficult to diagnose. This is regarding the features of the nasopharynx. To quickly summarize, in the last few minutes, we learnt about the details of anatomy of nasopharynx. Nasopharynx is part of the pharynx which lies behind the nasal cavity. It extends from the level of base of the skull to the first cervical vertebra. It has got a roof, a floor, an anterior wall, a posterior wall and a lateral wall. The roof and posterior wall presents important features like the nasopharyngeal tonsil, the pharyngeal hypophysis and also the pharyngeal diverticulum. The lateral wall of the nasopharynx we saw contains the pharyngeal opening of the auditory tube, the tubal elevation with tubal tonsil, then two pairs of mucosal folds, salpingo-palatine and salpingo-pharyngeal fold. We also discussed regarding the clinical relevance of each of the features present in different walls of nasopharynx. In our next video, we will focus our attention on the anatomy of oropharynx. Thank you.